It's an issue that is top of mind for a lot of parents, kids, and social media. The U.S. Surgeon General issued a rare warning this week about the potential harm to young people and mental health, with excessive use impacting sleep and relationships and depression. The Surgeon General pointing to a youth mental health crisis in America and says social media is a big part of the problem. This morning, Vermont's Commissioner of Health weighs in on what parents need to pay attention to. Dr. Mark Levine, welcome back to NBC5 In Depth.
Great to be with you, Stuart.
The Youth Risk Behavior Survey is nothing new, comes out every couple of years, but for those who are unfamiliar, why is it such a useful tool?
This allows us to really understand so many aspects of the health of our youth, both at the middle and high school levels. We learn a lot about their lifestyle habits. We learn about their mental health. We learn about how they feel about themselves and their place in their community. We learn about their involvement with use of various types of substances, whether that be from nicotine on through cannabis. Just gives us a wealth of information. And it's a very standardized and validated survey. So most times we can compare very directly with previous years' experience and understand when there are trends.
The high school survey involved 17,000 Vermont kids. In middle school, 12,000 Vermont kids. And everyone always asks, these are some pretty sensitive topics. How do you know kids are telling the truth? How can you trust this data? What do you say to that?
Yeah, that's a great question. Turns out that that experience over time tells us that youth are quite honest about these responses. And though the topics may be very sensitive, they feel very comfortable, at least in a survey, talking about them. Obviously, they're anonymous, so that helps. But, lots of parents understand that when they put out a bowl of taco chips and salsa and just hang around the kitchen, often the same kinds of conversations occur with youth who are in their adolescent age years. And that's what we find. They're very willing to talk about topics that we might have thought were kind of on the fringe and might not be something they would honestly like to engage in.
Well, with that said, some of the interesting findings, and there are a lot of numbers, and we're putting some of the key points on the screen, but mental health. Again, this data was collected in 2021. It was released by your department this week. More than a third of high school students say they are or were struggling with their mental health. That sounds awfully high. Is it to you?
Yeah, so keep in mind, this is right during the pandemic. This is an area where we've been worried about youth even before the pandemic. We've documented from middle school all the way through college years, even before the pandemic, how much utilization of student counseling services was occurring, how much stress students felt, anxiety, depression. And so during a pandemic, we would certainly not expect that to have disappeared. And clearly it increased and was a significant factor. So the fact is, few of us growing up experienced what these kids have experienced over time. They have basically had periods of time where their education was significantly disrupted. Their social and emotional development did not proceed as they would have planned. And lots of kinds of milestones might not have even occurred because of the fact that they were under different conditions during a pandemic. So unfortunately, this was not a huge surprise.
LGBTQ kids 4 times more likely to report feelings of suicide or report making a plan to kill themselves. Is there some additional factor that explains that?
So this is something we've seen even before the 2021 year as well. And coming out of the pandemic, as we can see around the country now, the number of states that have either proposed or passed legislation that is discriminatory against LGBTQ plus individuals is escalating and quite large. It's so nice to live in Vermont, where nothing like this has occurred to date. The fact of the matter is, the trans part of the population especially has had many, many discriminatory laws proposed or passed across the country. So you can imagine the challenges to mental health living in an environment where you're feeling like people are actually not in support of you at all, but the opposite. So these are very, very challenging. But we've known in public health for quite some time that asking simple questions about mental health shows us, on average, an extraordinary level of people who have distress. And then when we try to focus on populations like those defined by gender orientation, racial orientation, socioeconomic or educational status, those groups show increases in all of the distress compared to the average person, if you will.
And female students were much more likely, twice as likely, to report feelings of, considering hurting themselves as were male students. What's your read on that?
Yeah, that's a trend that's very disturbing. And I think we need to get down to the root causes of that a little more. For females, it has been always true that they're having an excess of those kinds of concerns compared to males, but it seems larger right now. I think one of the bigger factors that we don't talk about a lot, but that needs to be discussed, is the impact of social media and the pressure people feel when engaged on social media, where everyone may look like the model, everyone may look like they are having it just fine and their life is going well, and it conceals a lot of the distress that general people are feeling. These kinds of scars, this kind of burden that they bore during the pandemic, unfortunately doesn't just dissipate as we try to get back to a more normal style of living. So I think the impacts here are persistent and need our undying attention at this point in time. We should be as concerned, knowing that this is still 2021 data today, even though we don't have a new survey to show us how people are feeling this moment.
Well, particularly with regard to feelings of suicide. I mean, Vermont does have a higher than average suicide rate. And if you're a parent of one of these middle school or high school kids, how do you approach talking to your kid, if particularly maybe your kid identifies as part of the LGBTQ community? How do you probe for feelings along those lines?
Yeah, those are great questions. I think, being an active listener is probably the most important thing because, as I said, kids will talk to parents about these issues, usually not when they're directed to or when the questions are very much focused and forced on them with a particular issue in mind, but just sort of sitting back and letting your kid talk about how they feel about things, talk about the experiences they're having and how you can help them navigate these waters that we all navigated growing up in time over the years. The new navigation issue, though, is, again, contending with the power of social media, contending with the power of kids who are no longer as in-person engaged with one another as they might have been in previous generations. There's a wealth of resources. As you mentioned, the rates of suicide in Vermont. Suicide, of course, impacts all ages. And we know that some of the demographics are actually very old, and old males in our state, especially those who have been veterans. But on the younger side, we're very concerned about adolescents, obviously. And our Facing Suicide VT website has very many helpful hints in it.
It's a tough conversation to have, but these conversations are important. And there are so many resources out there, ways to educate yourself on signs to look out for and about which communities may be at greater risk, programs to share with someone struggling, like phone support, mental health counseling, and peer groups. All of this exists so no one ever has to feel alone. This is how we can start facing suicide together. This is how we can support those battling loss, loneliness, trauma, and mental health struggles every day. We can listen to them.
Those who have had a suicide gesture or wish, over 90% will survive later on and never attempt suicide again. So there's a lot of hope on that website as well. And I really direct people to pursue looking at that, because it gives the experiences of survivors, the experiences of families, whether their loved one has or has not survived suicide. And it's very, very helpful firsthand accounts.
Let me ask you about vaping, drinking, and cannabis. You've asked these questions before. Vaping is the new thing. But vaping, 16% of high school kids reported vaping in the previous month. 25% of high school students reported drinking alcohol. 20% reported using cannabis I guess in some form. Are those sort of consistent with recent trends?
Yeah, unfortunately, we do see time after time these kinds of trends. The vaping one is a little hard to break down because there are so many interventions that occur, and you like to see the impact of those, but then sooner or later, something else happens. So for instance, a few years ago in 2019, we passed laws trying to prevent internet access of electronic vaping products. We increased the taxes on these products to put them a little bit out of reach. And we increased the age of acquisition of any kind of smoking materials to 21. As you know, the Juul company has come under a lot of intense pressure regarding their use of flavors to attract youth. Even when active legislation occurred to try to limit that, new ideas came in the industry. Disposable products that have really taken over where Juul left off. It's almost like you're putting your finger in the dike every time you create something, and then they find a workaround. So unfortunately, youth have had these issues. One of the best ways to prevent youth from even going down these pathways is to make sure that those after school hours are occupied maximally with productive activities and activities that youth feel good about, that they've engaged in because they had a voice in deciding that that would be what they do. So after school programming, which we really ramped up during the pandemic, is something that we always need to pay attention to so that youth don't get into experimenting in ways that won't be productive for their overall health. The other part of this is really, how do youth feel in their community and in their family structure? Do they feel valued? Do they feel a sense of connectedness? The good news is a little over 50% say they do. I'm much more worried about the under 50% who either aren't sure or who say that they don't feel connected, because we need to really work with youth in ways that will enhance this level of connectedness and feeling like I matter to my community.
We just have a minute or so left, but I want to ask you about a headline the other day about the development of, or a clinical trial for a new kind of flu vaccine that potentially could be universal and much more effective because it would work against all strains. And it uses the same mRNA technology that we saw from Pfizer, for example, during the fight against COVID. What do you think about that?
Yeah, this is something that's been cooking for a little while now, and it's great that it's actually entering a significant clinical trial. Most people understand that every year we make a new flu vaccine for the fall based on what happened the previous spring. And it's a best guess effort at what strains are going to be around, and we hope it'll be a good match. This newer type of vaccine, based on the mRNA technology and platform that was so successful during COVID, is something that is, as you use the term, more universal and would provide a broader coverage that wouldn't be, I hate to reduce it to this, but as much of a hit or miss kind of enterprise. It would have a much higher likelihood of success. It would also share in being able to potentially provide flu and COVID vaccines together for those who want to get them at the same time, since they're both based on the same mRNA platform. And that would enhance the compliance rate with getting shots, because you wouldn't be as forgetful if you could have them both at the same time and not get one at a time.
Certainly sounds like it could be promising. That's where we'll leave this. Many thanks. Dr. Mark Levine, Vermont's Commissioner of Health. Appreciate your time this morning.
Thank you so much.
You'll find links to the full Youth Risk Behavior Survey and see how things have changed over time at healthvermont.gov. Next, it's graduation time. We'll be talking